Day 3 at Arab Health, here on the M42 main stage. We are so pleased to greet you all here this morning, and we have a fantastic day of programs lined up especially for you. Now, this is day 3, and we've had 2 very popular days here. I would say at the most popular booth here at Arab Health. Thank you so much for joining us and learning all about the M42 journey. We are at the nexus of technology, sustainability, and health, and at the forefront of the very best of what the UAE is offering the world. You have heard from our brilliant global speakers about our international collaborations that are happening here in the heart of the UAE. And the expertise, I have to say, as someone who's been based here for the last decade, the expertise is very much homegrown. It's in collaboration with our international partners here. I'm proud to say I am one of them working here in the UAE, and we are exporting the expertise that is being developed here in this region. Now, this very first panel, it kicks off on a very high note. We're going to be looking at revolutionizing the patient experience in healthcare. And to take us through this, we have a very illustrious speaker list. Allow me please to introduce them. They'll all come on stage and then I'll be handing over to our expert moderator. So first of all, to begin with, may I please invite on stage Omar El Nakbi, the acting CEO of HealthPoint and Danat El Emirat, the Hospital for Women and Children. Please give him a big round of applause. Next up, we have Rana Luckman, the Senior Manager in Patient Experience at M42. A warm applause for Rana. Manisha Patel, Director of Clinical Operations at Mubadala Health, Dubai. Brent Whitaker, Director of Nursing Operations. And I'll be handing over to our very own and very favorite, Dr. Fatma Radin, the Senior Director, Clinical Development, M42. The biggest applause to Dr. Fatma. And as I give you the mic, please do check that our panelists are seated where you'd like them, and the stage is yours.
Thank you so much, Amandip. Good morning, everyone. Assalamu alaikum wa rahmatullah. Everyone is ready? Yes. I can see a lot of representatives from patient experience. Does this matter for you? Is it a priority? Is it a priority only for her? I didn't see hands. Hands. Then let's look to our panel and go ahead with the talk. Please have a seat. I'm honored to be with you today. Patient experience. Omar Nakbi, the CEO of HealthPoint and Danat. This is a huge responsibility. Let's start with you. I know that this is in your scorecard. Then, patient experience. What are the opportunities? What are the challenges? Can we improve more and more patient experience?
Thank you, Fatima. I'm privileged to be here today. Thank you for inviting us and to be part of this panel. Patient experience is becoming one of the very key deciding points for patients to choose where they would like to receive care for themselves or for their family members. So providers need to invest heavily in making sure that the patient journey, it's seamless, it's cumbersome free, so that they come, they schedule their appointment, they leave without any burden. And there is a huge opportunity for providers to invest in technology to make sure that this patient journey is very seamless. Personalized care, as we heard this morning, the clinical genome program, those are very key for us to be able to, allow physicians to spend quality time with the patient. So that 30 minutes or 20-minute slot is spent with a quality time with the patient, not documenting, not wasting their time doing administrative stuff. This is where technology play a big part in removing that burden and allowing physicians and admin as well focusing on that patient journey.
Excellent. Thank you so much, Omar. Can I ask you one more question? Okay. If I'm a patient coming to you in Health Point, what will be your priority?
My priority is to give you the best service from the minute you decide to come to HealthPoint. So that's either from the call center or from the referrals from any other facility to give you a very seamless journey. So I put to myself a target of 90 or 100% of our appointments are given within 7 days. Yes, we are not able to hit that all the time, but this is what I work with my team to allow patients to get the care when they want it and not when it's convenient for us. And that's part of my goals and this year as well is to make that even shorter. So
That's amazing. I can share my experience, okay? You exceeded this 100%. I was one of your patients. Thank you so much. Thank you. Let me go now to Manisha. Manisha is the Director of Clinical Operation in Mubadala Health Dubai, a new organization, and this is the last, in fact, asset and hospital for Mubadala Health and M42, okay? What are the opportunities, how you implemented the patient experience department, how you are offering a great patient experience in Mubadala Health Dubai?
So, from my perspective, again, like Omar said, patient experience has to be key of what you do for your successful business. I think it's not just so much of always seeing it as a business, but more so that we're here to provide that healthcare for families, for patients, and for people ultimately. I think the most important part is having a really good MDT focus on everything we're doing, really making sure that we appreciate all the aspects of what a patient needs. Ultimately, patients use our facilities or clients use our facilities when there's a need. So how do we address that need? Making sure we look at it where you're holistically treating everything, not just that one aspect of what they come in. Now, one of the ways that we really push and support that at Mubadala Health Dubai is by having a really strong focus on patient experience from the minute they walk through that door, not just from when they book the appointment. So the minute they walk through the door, giving that personalized approach, understanding what their concerns are, understanding where we can support them with what their concerns are, but also having staff on the floor who also appreciate and understand the importance of the patient experience.
That's amazing. Let me congratulate you for the accreditation for Mubadala Health Dubai. I want an applause, please. Thank you. And then let me ask you, one of the largest chapter of GCIA is patient experience. You've spoken about the MDT, and you are in UAE. I mean, from where are you, Manisha? Let me ask you.
So I'm from the UK. I think most people could tell I'm very British.
Okay, looks good. Okay, I'm terrible in accent, as you know. Okay, tell me what's different. Okay, how you implement this cultural sensitivity in Mubadala Health Dubai?
I think MDT is still something fairly new in our region. And it's reassuring the patients that we're doing it from the perspective of we're holistically treating a whole picture rather than just a key element. A lot of this does take a lot of reassurance, but it also takes a lot of our physicians, our nurses, our allied health to all be talking the same language. I think that's very key, but also making sure the families are involved in the care that we're giving. So there's very much that push for a family-centered model to make sure that, when an individual comes in, we also involve the rest of the family in that decision-making as well, especially if it's a pediatric patient or an elderly patient or any family member, that everybody is involved as much as feasible.
Looks amazing. I mean that you're moving from a patient experience, okay, let's say team, to patient and family experience. I like this holistic approach. Thank you so much. Thank you. Let's go to Rana. Okay, Rana, you are a senior manager in M42 Corporate. Tell me how you are coordinating this large team in all our assets, Abu Dhabi and worldwide, and what are your priorities from the corporate sides?
So thank you so much for this talk. It's very important to talk about patient experience and from a corporate level how we engage with all the assets. It's quite a large number, so we're not only looking at our team, but we're looking at every single department and how we need to give them that alignment on seeing that patient side from the feedback that we receive. So a lot of the key things and changes that we've done is change the word complaint to feedback. this gives a very positive element to the doctors and the nurses, where they see it from a different angle. And we aligned the way all the assets operate, where we're all working in the same way, we're looking at data the same way, we're looking at feedback the same way, and this makes it easier for us to, from a corporate standpoint, to be able to address it in a very holistic approach.
Thank you so much, Rana, and you are doing amazing. Thanks a lot. Thank you. Brant, how's Cleveland Clinic doing? I know that you have a huge experience on patient experience. Okay, tell me more, please, and tell us more.
Well, the Cleveland Clinic has a very strong
mic.
motto where patients are first. We put patients at the center of everything we do. We really focus on every aspect that we bring in is patient-centered, patient-focused, whether that be introducing a new technology, whether that is training new leadership. You focus on that patient even before the patient arrives, that the focus of the hospital has the same goal. Every single person you interact with is here for that individual. So even before that, the patient shows up to the hospital, you have the concept of what you're doing and how you're going to incorporate, when that person finally shows up, how to provide the best possible care.
Thank you so much for sharing your experience. Then, as you've seen, we are in M42. Okay, I need to ask you about technology. Then, how is technology optimizing and improving and serving our patient experience? Let's start with you, Mr. Omar.
Thank you. Technology is pivotal to transforming the patient experience. As I discussed earlier, we are exploring AI technologies to help us remove the burden, the administrative burden from our physicians and our admin team, so that they focus on the clinical aspect of the care. Telemedicine is another example that we're using to improve access to our patients, so they receive the care when they need it. And the patient platforms as well. This is one area we are investing heavily on. These platforms allow us to streamline the communication between the patient, our physicians, and any other support services like pharmacy, medical reports, with the touch of their hands. So it's available in their mobile phones. So they don't have to invest their time and efforts to go and bring these, what we used to in the past, where you have to, spend a whole day to get a report. Now it's available in the tip of your fingers to get these reports right away, and to communicate with your physician. If you forgot to ask him a question or you need to refill for your pharmaceuticals, it's all available on this platform.
That's amazing. Okay. So you needed most probably to upgrade to a lot of other technology that you were using previously, yes?
Absolutely. Technology is one thing that is keep constantly changing. Just today, yesterday when I was visiting, there is a lot of new technologies that come, and we just invested last year in this technology. So we have to keep up with these technologies to ensure that patients really at the center of what we do, and to make that journey, that patient journeys, as seamless as possible.
Thank you so much. Manisha, for a new hospital, you're lucky because you implemented, since the beginning. Tell us, for Mubadala Health Dubai, technology and patient experience.
So from my perspective, in terms of patient experience and technology, it's key at Mubadala Health Dubai. We do have a lot of state-of-the-art equipment, being a new facility in Dubai, that we do have the diagnostics, the imaging, that we could potentially become a centre of excellence for that diagnostics. But in addition to that, it's also having an understanding of what we can do as M42. So in terms of, we offer our satellite clinics through Cleveland Clinic Abu Dhabi, or all of the specialist doctors, the specialism that you can get at our assets in Abu Dhabi, being the first one in Dubai, means that we can afford to do that and bring that over to us. And technology is a huge leverage for that. So in the sense of being able to use a super app, or being able to use telecommunication and telemedicine to support the patients, where if they're residing in Dubai, they can still access that specialist care at other assets. I know we've got a lot of our physicians who are also licensed across both Abu Dhabi and Dubai, allowing them to be able to allow that specialism, but also having EMR systems which can be integrated across our sites, so that you've got that continuous seamless flow in terms of the technology side of things.
Thank you so much, Manisha. Brant, can I ask you about Cleveland Clinic? You are on the top of the technology. Tell us more. Okay.
So Cleveland Clinic's technology drive has been there for a very long time, and incorporating with M42 has only
I
made
ask
it
you?
much, much stronger, where technology is improving behind the scenes information for the patient, so it's seamlessly flowing from one asset to another asset, where their EMR follows them, and they don't have to try to remember what the doctor said. It's already in their note, even though it's a different system, but same asset. Technology is also really, really implemented behind the scenes as well, so the patient may not have to interact with it, but it is helping to read their imaging faster. That is able to make sure that it's accurate across all assets, so that we don't have to say, oh, you had a scan at one hospital, let's have another scan at our hospital, that we can trust the information more effortlessly between different assets and even hospitals outside of our assets. I think Cleveland Clinic and M42 have a great opportunity to lead the world in this type of integration.
Absolutely. Thank you so much. Rana.
So with technology, we touch a lot on business intelligence, understanding the data analytics. This allows us to learn a lot about the persona of our guests or patients that come through. We have a lot of tools and methods that we use, and we like to be very versatile because it allows us to touch on different parts of that persona of the patient, and it allows us to kind of nip the problems from the roots as well, because we get to see, is there a common theme across the assets, or is it a particular asset? So we get to understand where we need to focus our improvements on. So it's part of our continuous improvements. It also allows us to look into effortlessness. So something that we're starting to touch point on, of not just the satisfaction of the patient, like how can we make the journey effortless? What are the areas that we're over adding, like steps that we're adding in the journey? Does the journey need a bit of improvement? How does that improve the satisfaction of the patient? How does it short the time spent? So that's where we've tapped into the use of technology in patient experience.
That's amazing. Thank you so much. It's amazing to have leaders, okay, from M42 in front of me. But then leaders are having also huge responsibility, personal touch, and again, huge responsibility. For how are you implementing a patient-centered care and optimizing on a personal level? I want your touch and your experience within your hospital. Mr. Omar?
So as I said, patient experience is key. That's why it's actually in my scorecard, and it's in my executive team scorecard. And it trickles down to every single caregiver, whether they directly interact with patients or indirectly interact with patients. So that's how I ensure, and it trickles down to every single person in the hospital, from the cleaner all the way to the parking valet team, all the way to the physicians. All are responsible from delivering that culture of patient-centric model from the minute the patient enters the door until they leave. So I actually infuse in our daily huddles with the executive team, a portion of it daily is to discuss the patient experience issues or compliments or complaints, so that if we see a trend, we address it right away, so it doesn't become a big problem. Patients is also part of our decision making. We've established some committees where patients actually sit in these committees, and they are involved in the decision making that we make in the hospital, which has proven to be very, very effective, because we're seeing it from their eyes. They're the end users, and listening to them has been really very integral. That's something we started last year and has benefited us a lot, and have made a lot of changes to the way we see things from their eyes.
That's amazing. Do you have any personal experience or patient experience that you want to share with us?
There is a lot of stories, Dr.
Give me one.
Fatima. So we've introduced something called case management, and also in our hospitals, and they're responsible in coordinating the care across all of the 29 facilities we have at M42. We have more than 1,000 doctors around the facilities. So, and those expertise sometimes patients don't know about. So this case management team has helped identify if the patient has an issue and coordinate their care. So they don't have to go and seek the care. They will coordinate the care, whether it's available in Imperial College London Diabetes Center, MH Dubai, Danat Al Emarat, Health Point, or Cleveland. This team is really delivering, and we've been able to help a lot of patients. One of them was shopping for her problem for multiple hospitals, but when she met this team, we were able to help her and change her life at Danat Al Emarat Hospital, which was really amazing. And we have a lot of stories coming from this team that helps patients really finding the accurate care for themselves.
Thank you so much for sharing your experience. Manisha, tell me more. Your leadership style. How are you impacting patient experience? How are you leading all your team in Mubadala Health Dubai?
So my approach to leading patient care is very much focused around having an open, honest and transparent culture with my team. So not just the leadership team, but everybody that works in the asset. So one of the things that I did implement when I did start with Mubadala Health Dubai is the coffee morning sessions that we support with Human Capital once a month. Those coffee morning sessions have been pivotal in understanding, in creating an integrated culture of care delivery at Mubadala Health Dubai. So it just means that it gives the platform for the staff to be able to discuss those concerns or sort of raise discussions that are happening. I think it's really important that we can look at our Presgani scores. We can do all the collective reviews of, any reviews that we're getting. But what do we do when somebody has raised, a bit of a concern or something that maybe we could have done better with? So one of the things that we do as a leadership team is that we'll do patient journey reviews. So reviewing that patient journey and thinking, well, what could we have done better to support that patient? Are there areas that we need to improve in logistically? Are there, steps that we need to remediate? Again, that's been really useful to implement at Mubadala Health Dubai.
Thank you so much. Thank you. Brent, can I hear from you?
So we start every day with a safety huddle, and in that huddle, obviously, we review any of our safety concerns, operational, patient concerns, outcomes that we're looking for, collapses, qualities, but we also focus on patient experience. Every single morning, that's a part of our component. How are we doing? What's something we can highlight? Or are there any risks or concerns to our patients coming up for the day? Is there a flow issue? So every single day starts with a focus on how can we improve our care from yesterday to today? And our patients are the center of that. So starting a day like that, and that's all leadership, and it's open to every single person in the hospital to either attend in person or to listen to online. So it's a very encouraging metric to get there, to be a part of it, focus on the patient for the day, and improve the care today over yesterday, every single day.
Thank you so much for sharing. Rana, from the corporate, share with us.
From the corporate, we have been able to empower our caregivers with leadership training. This gives them an understanding of what leadership is and how they can build it in within the culture. It allows them to see how they can support in improving the patient experience, but with that leadership and culture mindset. And this allows them to grow to future leaders, and that's what we need them to be. We need them to be the future leaders. So, yeah.
Thank you so much. I want to share with you as well, okay, a decision was made years ago, okay, on the corporate of Mubadala Health and then M42, who was to create the department of patient and family experience. I want to share with you the experience I had with Amana Healthcare, the long-term facility, when initially they created this department, and from a cultural side, Amana is a long-term care. So you can understand that a patient there is a resident, okay, and that patient experience is a must. When you are living for month and month, you need to be considered as a member of family. And I want you to applaud these amazing, local ladies who were there 24 hours per 7, who during COVID time, okay, these patients who were there for months and months were not able to see their families, but their families were Amana team, patient and family experience team, who were there to call them, to WhatsApp them, to email them, and to be there as their family. Kindly, I want you to applaud the patient and family experience in Mubadala, in Amana, in M42, and in all the healthcare. Thank you so much for being with us today. I want from you now, okay, some question and interaction, please. Anyone want to have a question with our team? Any comment? Any testimonial? We're happy.
Good morning, and thank you that I got the opportunity. I'm Dr. Tara. I'm a consultant anesthetist and pain management and regenerative medicine in a global care hospital in Abu Dhabi. Okay. I'm so happy today that I hear that you care about the patients and for the future and to improve of what's errors or what's wrong. But there's a very important point that I think still now they are missing. This point that how much time now the doctors stay with the patient. 30 years ago, I stay with the patient, hearing him, texting him, examination, all of this, make him relax in 25 minutes, and I only document in 5 minutes. That was 30 years ago. 20 years ago, 15 minutes was only with the patient, and 15 minutes documentation. Now, 25 minutes minimum to document these HIS things, and only for the patient 5 minutes. My patients are not satisfied. My patients, they are all chronic pains. Chronic pains they are suffering from. Cervical desk, lumbar desk, these chronic pains that I have to inject, I have to hear him, I have to examine him. I have no time for that. Doctor, you have to go to the HIS. You have to write this. Oh, sorry, this is not right. Let me tell you something. I made my own work that I asked my nurse to sit on my chair, and I am talking all the time with the patient, and she's writing what she's saying. You know what I mean? So now I did this, but I have to tell you that, please, do that. Do something that the doctors, the patient needs us to talk to feel him, to understand him. He paid a lot to see us, and he has all the right to have me. Not just 5 minutes, okay, then I just put my face to the screen and this is wrongly. Please put it in your mind. Patients are suffering from this point. Thank you. I'm sorry for interrupting.
No worries. Thank you, doctor. Actually, we've already explored AI technology that help the doctor while you're discussing the case with your patient. It's already capturing all that data without you investing any time in putting this data together. So that's already one solution that we're actually exploring as we speak. We signed yesterday an MOU with Gosh, Great Ormond Street Hospital in London. They have this technology also available. The physician is spending the entire time with the patient, so he is not actually documenting. The technology already capture all of the discussions, and it helps actually dictate and put into the records all of the information that was discussed between the patient and the physician. So you're right. Your 30 minutes it should be 30 minutes with the patient, not in the front of the computer or in front of the trying to type and ensuring the HIS, the insurance, and everybody else is contented. This technology already remove all that burden from your physician.
Thank you for sharing your testimonial, a physician testimonial. Okay, that's amazing. I will add to what Mr. Omar is saying, that we don't want our physician and clinician to feel alone. I feel sorry when I'm hearing you as a colleague saying like that. We work as a team, okay? Before coming to a physician, there is also the call center, the people who call this patient. The patient is not having only the physician. Before the physician, he was also reassured. He was spoken by the team. There is a patient experience team who are there also. There is the nurse. There is all team, part of this care that he's expecting. And one more is a lot of training. I know that, let's say I'm 50 years old, okay? Years ago when I was trained in medical school, I was not trained in technology, but it's very, very important that when we join also the organization, we go through a lot of training. It's their responsibility from the leadership also within the hospital to make it available for you that you are trained, because we can write, okay, within 10 minutes, we can do it in 3 minutes. When I see how my son is really quickly in writing, it makes a difference. But again, technology, okay, is one key, is our friend as a clinician to let's say, optimize also our physician, okay, experience. Thank you so much for your testimonial. Thank you so much, everyone. I hope for you and I wish you a great M42 and Arab Health experience. Thank you.